Hello.
Hi Lizzie, how are you doing?
Yeah, good, thank you. Hello, Robert.
Hi, Lizzie. Hi, John. Hi,
Good to see
Carmen.
you. Hi Carmen.
Um,
Sorry
just
again
want
for the delay in the slides.
they
Hopefully, all
arrived.
good
Don't
now.
worry. I'm going to apologise because although I'm putting the slides up, I haven't had a chat with Sian, who's hosting, and she may need to squeeze you time-wise. We're overrunning drastically.
Okay.
Or we may just be generous and ask everyone to give you the floor as planned. So we've got two sets of presenters coming forward, but nice to have you as a trio from
Thank you.
Dorset.
I just wanted to I've got to collect my daughter at ISO. The latest I can leave is 3:10. So, but I'm happy to share. So I've had to write some extra notes, Lizzie, on my slides. So I was going to present our actual dice page itself, which might be easier. But if I can't do that, then I hugely apologise. But I'll share my stuff with you, Lizzie, if you like, just so you've got it.
Let's try and make sure that you can do that before that deadline. But thanks for letting us know. We're recording, so let me put the slides up and show that happening. Hi, Faye. We're just getting ourselves ready. Nice to see you. So, can someone who's off mute just tell me that we've got
Sharing,
slides up? Yeah, lovely.
Hi, Robert. Sorry, I didn't realise I was muted. I was chatting away.
Oh,
You heard none of it.
that's all right. You can't see me now because I've hidden behind the slides, but hello, nice to see
Oh,
you.
you're on my side panel. I can see a very small head.
Oh, good. I was just saying to the others that we've been overrunning a bit with the
Yes.
conference, and the conference chairs said let's just go with that. So we're probably going to have to negotiate that, but we're conscious of the fact we want to get some things shown about the platform that DIS have got, but we've got childcare responsibilities to juggle as well. So we're going to try and juggle our timings to enable that to happen.
Okay.
And Faye, you haven't met those from Dorset, so the other three in the room are Dorset.
Hello, Dorset.
Hi, Faye.
I'm up in not so sunny Sheffield, so it's probably nicer where you are than I am.
Not much. I'm in Yeovil, so not in Dorset, but I work for Dorset. I'm in Yeovil and Somerset, but it's pretty grey and miserable here.
Classic English weather, hey.
Blue
I live in
skies
Swanage and it's always sunny.
Yeah.
Oh, nice.
Blue skies in North London, so I'll send them all to you metaphorically. Blue seas in Dorset, I can see behind you, John.
So did you get the message that I need to do a live screen share as part of my presentation?
Yes. Are you okay just hopping on and doing that? I was got message, don't be frightened, that's going to happen.
Yeah, can I try that now? Is that okay?
Go for it, yeah.
Okay,
yeah.
Excellent. So
I actually will need to do the same as well. So
okay.
I did test it with some colleagues, but it'd be good to just to check.
Well, if you both did it at the same time, it probably here we go. Something's.
this is what I need to share. Is it populated? It's a website. Says the Centre for Care. Can you see that?
Yeah.
And I'm gonna click onto this unpaid care dashboard, and it should scroll with me and you. Is that working?
Yeah.
And then this is the big demo of what I'm going to be showing. So I just wanted to be sure that this is populating some graphs and charts and lots of numbers and a map. Has that happened?
Yep. All coming through.
Okay, superb.
So if you could take that down and come and have a go. If Faye has done it, I have every confidence.
Absolutely.
I've took it away.
And just to say, gremlins do creep in, so we'll work around them. and when.
You see that?
Yeah,
Got lots of
that's there.
demographics.
Yeah,
Got lots of
that's there.
demographics.
That
Wonderful.
looks
in
Yeah.
front of me.
interesting.
So this is this is all of Dorset's insights, but we can filter down, which I'll go through on the informal carers
Ah.
on here.
Where have all the children
Fantastic.
gone? That's very different to North London profile.
I think we might have
It's
interest in
Dorset.
each of our presentations, so they're well aligned.
Yeah,
It's,
which is great. I had a quick look at at some of the slides earlier.
So I was presenting with Matt Bennett, and he was basically the presenter, who's our professor, and he's traveling at the moment, so it's me instead. So you've kind of got a silver medal. But I think we've only got about 15 minutes that I'll be presenting for, so hopefully, and I should have my colleague Tom Siddle is going to join, and he might be able to be part of any Q&A that comes up, but I'll be the main presenter. So if Tom pops in, oh my goodness, it's like he heard us. Hi, Tom.
I wonder if
literally
it would
just said
be
your name.
possible to maybe swap. I know it's a bit tricky to say now, but to swap so that Carmen potentially, so our bit goes first.
I've got
because
childcare
the
issues.
Yeah.
Would you
if that's
mind
gonna
if we
be
did Dorset first, folks?
would that be
Um,
okay?
Or
I've
you-
got another meeting at 3:30. Are we finished by that point?
I think so.
Feels like we would be. Yes. Yeah.
Perfect. Yeah, absolutely.
Okay.
If I run over by a couple of minutes, then fine. That's it's with a colleague, so I can just say that I'm running a little bit late.
And hello, Thomas. Nice to meet you. I'm just going to put your name up on the slides. But I'll also say we're overrunning a bit drastically on our conference. So we're going to have to sort of ask people to bear with us to give you the bandwidth this afternoon. So Sian, who's going to host us, is going to be coming in the room now, but we should have been started 3 minutes ago. Now I'm expecting people in the room before past. A really powerful young carer talking about caring for her son. I said caring for her sibling, and around palliative care that he needed, and we let that run very rightly.
Yeah,
but also
definitely.
there's been a lot of enthusiasm in the room for the cause, and we haven't been as tight as we might have been on timekeeping. So just to give you the context of where Sian's going to walk into the room on this.
Okay.
Robert, can I just confirm, are you in control of the slides?
Yeah, I'm going to put the slides up.
Okay.
Are you, and then what happened when you did your sharing is that it just bumped me off.
Oh,
So
great. Okay.
that's the technical term, I think. So feel free to do that again.
Okay.
When we come to the dice bit, I think we've got 5 minutes. I'll probably share the slides that I've got because I've got some annotated notes on there. So I need those, and I've got a link directly to the Power BI report I need to go to. So I'll probably bump you off when I come to my bit, if that's okay.
Yes,
But the
please
slides
just do
look the
that.
same.
I'll find a way back in as long as you get yourselves
That's fine.
on sharing what you want to share.
Wonderful. Thank you.
Is there a potential need to slice things down just a touch, do you think, to fit into the timing?
Sort of tiptoeing around that. I haven't managed to talk to Sian, who's hosting this. I'm sort of was asked to come along and put the slides up. I would say there's a likelihood we are going to need to prune it a little bit. But can we just read the room when we come in, and Sian will come in with knowledge of what our slot is. It's not I don't know how she'll play it. But
it might just for me, I can just whip past a couple of slides. So if you're the slide controller, then I'll just move a bit faster through them and not dwell so much, and I'll move on to the live demonstration as more of a focus.
Okay, brilliant. And what I want to do is try and protect the Q&A, where we get people participating and discussing. So that's instead of the 20 minutes, it may be 12 and a half, which isn't a small slice, but I have confidence that you'll be able to convey what you want to convey.
Mhm.
Hi, Annabelle.
Hi,
Awesome.
sorry I'm late joining.
No, we're running a bit behindhand, so we haven't got started yet. We're just sort of getting ourselves ready for presenting. And I'm just going to put my contact details in the chat just in case there's anything that we're not expecting. You need to send me a message.
So, Robert, are there people in a waiting room at the moment?
Can't see them. I'm going to stop sharing and go and have a look.
Maybe Annabelle's the only one that wants to come and listen to information about data. Out of nearly 200 attendees.
I'm going to nip back in the main room. I'll come back in here in a minute just to find out what's happening.
Okay.
That we need some music. I'm not very good with silence.
Oh, I know. Carmen, what time do you need to leave?
8:10 at the but I have to be out the door at 3:10.
Yeah, right.
So, yeah, and then run. Luckily, my daughter's school's on your housing estate when you live on, but I'll need to run at that point.
Yes. Got your trainers on already.
Oh, yeah, I'll have them right here.
It's the worst environment, though, isn't it, when you're about to present something?
And the rushing, I know. Have I got a snack? Have I got the umbrella? Have I got the scooter? It's all by the front door.
You're primed and ready. It's not your first rodeo, it sounds.
No. It's just the stress of trying to get through a presentation, because then you're trying to rush it, especially I'm like, oh God, it's 3:05 and I'm not near the end.
Oh.
So I'll just be very aware of the time, unfortunately.
Well, maybe Annabelle is our only audience. Thanks, Annabelle. At least someone wants to hear.
No, don't worry. They're just overrunning in the other room. They're talking about the isolation of caring, and how that needs to be addressed. And we've got the isolation of waiting for participants here to cope with, but we'll be up and running soon. I'm just going to double check that I can share my slides, because I know I've done it once, but then having let you try the other things, it wasn't working. So here we go.
Yeah, that's worked.
Okay, so why don't I put that up now? So that's
Great.
ready for you.
Shall I just try sharing mine quickly and then see what happens when I stop sharing to see if that works?
Yes, that's fine.
I'll do that now just so. You can see that. And then if I stop sharing, can you take control from me?
Let's have a look.
Do you want
I can just click share again and go back to the right window.
Because I can stop presenting, but I don't know if that's it just stops for everyone. Fab, so you've taken over.
Yeah.
Yeah, so if you just shout take over now, Robert, and I'll
fantastic.
do that which I've just done.
That's fine. Wonderful. Thank you.
Robert, just on that slide, I think Tom's name hasn't been completed.
I was halfway through it and I was trying to think 4 different things at once. But Tom Siddle, I was going to ask you how you spelt your name. And I think is it,
yeah,
Tom?
that's right.
W-E-A-L-L, yeah.
And you're from Sheffield Centre for Care as well?
The University of Sheffield.
Yeah, University of Sheffield.
There we go.
Honorary, I think, to the Centre for Care, Tom, I would say. Like an alumni.
Yeah, I
Honorary
keep pinching my
member.
foot in the door. Yeah.
You'd be very welcome at all of the staff dues, so I think you're Centre for Care.
Looks like you've got a wealth of data in that dashboard, Faye.
Yeah.
So you know, it looks like you've kind of got you've got everywhere. It'd be really interesting offline, obviously, to find out exactly kind of where you've got all of that, etc., and potentially, yeah, how we can
Of
potentially link some of the
course.
work.
I tell you what, if you want to, I'm just thinking, can I send you a message here? If you wanted to email me,
I will
I
do.
can
Yeah, that's
send
great.
you a pre-recorded training webinar about the dashboard. Because if you've got to run just as I start, then you'll miss the interesting part that we might have.
That's great.
Let me see if I can. Apologies, tried to call you, Carmen, and hung up on myself.
Okay, so it's fine. I was like, oh gosh, broken it.
I tell you what, if I just put my email address in the
That's
chat.
fine. I can, yeah, I can pop you an email. That's fine, and just say hi. That'd be great. Thank you.
Yeah, I'll send you all the information about it. It's census data essentially.
Okay.
That we have been able to access different forms of it as well that has supported us. And Tom right here is the creator of the dashboard, so he is the brains. I'm just presenting on behalf of Matt, our professor, today. So
It's brilliant. Thank you.
yeah, readily available on our website, and so feel free to have a little look yourself.
Welcome, Sarah. Others are joining now, so here we go. Just waiting for Sian to join us in the room, then we'll get ourselves started. So my silence is that I'm just looking out for Sian to see that she's in the room with us, who's hosting today, before we introduce folks and get going. Thanks for hopping over into this workshop, and looking forward to introducing our presenters. So sorry about this delay. If you just joining us, the main hall was overrunning by about 10 minutes. Expecting to kick off any minute now. And do you know what? I think because of no showing of Sian, I'm going to host today and say good afternoon, everybody. Really warm welcome to you. This is a data workshop, so we're fitting data with carers, putting data with people, and I'm delighted to say that we have two sets of speakers to help us navigate the data. I'm going to put some slides up and then disappear behind the scenes. But if I could say to you, we're going to start off with colleagues from Dorset Healthcare, NHS Foundation Trust, ably abetted by Help and Kindness in the guise of John Sloper. If you could introduce yourselves as I put up the slides, and then we'll follow that on with going north to Faye and also to Thomas to hear about all things data and people up north. So here goes. Slides. Sorry, I'm Robert Edmonds. I'm working in NHS England in the Insight and Voice team and supporting behind the scenes with this conference today. Start talking, Dorset. I'm just putting the slides up.
Oh, okay. So my name is Lizzie Eden. I am the Carers Engagement Facilitator for Dorset's Primary Care. John, did you want to say hello?
Yep, I'm John Sloper. I run a community interest company, a social enterprise called Help and Kindness, and our mission is all about making it easier for people to find help and work together.
And Carmen?
Hi everyone, I'm Carmen Taylor. I am a business intelligence partner in the DICE team, so that's the Dorset Insights Intelligence Service, which I'll talk a bit more about in a minute, and I lead on primary care.
Great. We don't have any slides up yet on my screen. Does anyone else?
No, they're coming. For some reason
okay.
It's not behaving now, just as we wanted them.
Do you want us to introduce ourselves from Sheffield, Robert?
Please go for it.
Yeah. Hi, everybody. My name's Benskin. I'm the impact specialist for the Centre for Care at the University of Sheffield. So we're a research centre funded to undertake research on the topic of care, funnily enough. And we're going to be presenting our unpaid care dashboard, which is information from England and Wales. And Tom, do you want to just say hi?
Yeah. Hi, everybody. My name is Tom. I'm actually, so I produce the dashboard that we'll be presenting today. Though I don't work in care, I'm actually an economist by trade, but I work with the Centre for Care as well.
Thank you. It's normal sort of housekeeping rules apply, which you can see on the screen. Shout if you can't see anything. We're just switching this around here. So first of all, we're going to ask Lizzie to lead on data-driven approaches to leveraging health inequality in data systems. And then we'll come round to exploring and comparing local data on unpaid carers. Lizzie, over to you.
Great, thank you.
Whiz past down to the next set.
Yeah, I think it's slide 16.
Here it comes.
So yeah, this is us, carers data. We've already kind of introduced ourselves, so that's 2 slides. You can go to the overview if you like, Robert. There we go. So we're going to talk a little bit today about enhancing how we've supported GPs' practices to code in a more standardised way, and understanding our kind of dashboard. Carmen will talk about that. And then we've got John, who can talk about the kind of strategic overview. So feel free to next slide. This is probably where I'll start to ramble, so apologies in advance. But yes, improving recording and data collection at the ground level is kind of my bag. Better data can develop a better understanding of what carers' needs are and those that they care for, delivering targeted support both locally and nationally. In 2018, the carers engagement role spent a lot of time supporting the standardising of Dorset's carer coding. with the hope that our unpaid carers data will improve to a point that it is useful and will feed into larger data systems and help us understand the carers landscape. In Dorset, we use System 1 in primary care, and we really promote the use of one code, patient themselves providing care for all carers, as recommended by NHS England. For those in the room who don't use System 1 or coding, essentially it's just a structured clinical vocabulary that is recorded on the patient record. There are over 80 existing codes which relate or could relate to our unpaid carer, and thus primary care carer data isn't always that consistent or useful. Many guidance documents also support the need for better recording of carers, such as the government roadmap for adult social care data, the 5-year forward plan, the NHS long-term plan. They all make a clear commitment to identifying and supporting unpaid carers. With the 2021 white paper, People at the Heart of Care also makes a really clear statement to look at increasing the vocabulary or the voluntary use, of unpaid carers markers on NHS health records. Next slide, please. Our approach to engage and support GPs' practices in improving carer identification was to make it easy, quick, and clear to do. To do this, we suggested patient themselves providing care as the main code. We outlined best practice for staff referring to NHS England quality markers for improving primary care for carers document. We developed a really clear message, a banner, and it removes ambiguity. So clarity on how to code, awareness as to why and what to do next meant that more primary care staff would have confidence in coding and more community staff would request the code to be added to the patient record. We developed a System 1 template to help us standardise coding. All GP surgeries across Dorset can have access to this. It was developed by NHS Dorset with practice staff, carers, and social input as well, helping staff to code with some added features for good measure. To help us find more hidden carers, we worked with other teams and organisations, offering them a clear way to request a carer to be coded at primary care. This gave confidence to staff to take simple, proactive steps to support carers they came into contact with. Again, promotes our consistent message to support carers about how to code, what is best practice in supporting carers also. An example of how things can work really well came from a conversation I had with someone outside of the school gates, someone who works for SWAST, which is our South West Ambulance Service. I will literally talk about carers anywhere. We worked with our Dorset Healthcare's NHS SPOA team, which is a single point of access team, to create a process for any health or social care staff to follow to support carers that they meet. This process relies on community staff to identify unpaid carers to SPOA. SPOA then sends a notification to code kind of request to their practice, to their GP's practice, much like any other referral or request that they might send to primary care for input. This notification again reiterates guidance on our standard code, patient themselves providing care, best practice suggestions, and thus will also aim to join a carer to their local carer support and information service with the social teams. Interestingly, we didn't promote this project widely, as the SPOA staff themselves were reading between the lines and recognising carer situations from normal calls that they would get in regarding the cared for persons, showing that there's a real need for this support to be in place. For me, it's about coordinating our response to supporting carers across Dorset and across health and social care teams also, making sure that every contact counts. And here you can see the slide shows the increase of carers being identified since 2018. Now we're at 2025, again increasing to around 21,000 carers, with nearly 19,000 of those carers using patient themselves providing care code. The evidence, this evidences carers experience health inequalities and can be brought to the system for attention, discussion, and action. It helps us focus our attention on real health inequalities for carers, i.e. comparing carers' stats with non-carers. For example, we can see significant increase in depression in the 0 to 25-year-old carers compared to non-carers of the same group. So as a system, we need to ask ourselves, how can we better prevent mental health challenges for carers? Are there mental health services carer aware, accessible and able to meet the needs of carers in this age bracket? If not, what can we do together to support that improvement? This data can also evidence using carers as a cohort group for initiatives in Dorset. One area recently used carers as a cohort for conditions preventative initiatives such as BP at home, as data showed carers have a high level of hypertension. Unpaid carers template on System 1 that we built promotes patient themselves providing care code alongside other useful codes. This all feeds into DICE alongside other data systems. We have a carers filter that can look at trends and insights such as health inequalities for carers. Our data isn't perfect, and I hope in time that we will have confidence in our coding for, or more confidence in our coding for carers, although I already see great benefits happening. It starts at the ground level, and that's why I feel this work is so important. And next up is Carmen to talk a little bit more about DICE for us.
Hi, everybody. The slides should be okay as they are, so I won't worry about taking over at the moment. So if you go to the DICE slides, I think it's the next one. Actually, no.
Is that the one you want?
I can't see it yet. Oh, that's it. Fantastic. Thank you very much. So as I alluded to at the start, hi everyone, for those that came on after, I'm Carmen Taylor and I'm a business intelligence partner in the DICE team. So what is DICE? We are the Dorset Intelligence and Insights Service. And for those of you not aware, DICE is an in-house live population health management solution. We provide linked health and social care data across Dorset integrated care system. We provide the ability to look at what is happening in the now, but with also the predictive analytics to help better determine service needs and provisions for the future. The diagram you see on the left provides a quick overview of our data sharing partners, which we've worked really hard with over the last 7 years to achieve and make DICE what it is today. We've got 100% coverage for our Dorset G practices, as Lizzie alluded to. But we also have access to our acutes, the community mental health, and SWAS, so that's our Southwest Ambulance. We also use socioeconomic and academic data sets, and in the very near future we are looking to have further linkages, try saying that, to voluntary and charity sector organisations, which will be fantastic. Next slide. I'm going to try and whiz through these quickly, so apologies for that. This just gives you a very quick overview of the sort of numbers that are in DICE. So 100%, so but there's 1.1 million primary care records, 7.9 million outpatients. So this is just to give you an idea of the sorts of the volumes that we have within DICE. Next slide. This is our landing page. So this is our DICE portal, our landing page. This is heavily looked at and it's permission based. So but all the practices access this, and this is where they can start doing the work on the carers. Next slide. These are some of the key insights reports that we have, so around population profiling, full frailty, adult social care and conditions. The one I'm going to focus on now, I'm going to bring up our live DICE page. we're going to be focused on the insights and inequalities, because that's what I know Lizzie and your team's been using, but I know the practice has been using this to identify their carer cohorts, which has been fantastic. I'm now going to share my screen with our actual insights and inequalities, so I will do that now.
Thanks, Carmen. And whilst you're putting up that screen, just to say that we are under extreme time pressures, Faye, and know that we'll get some insights from you, but I know that I won't be able to give you the adequate time that I need to do you justice.
No, that's absolutely fine. Completely appreciate that. You know, as you said, you ran over, but it was for a really important reason, which is the most important thing to get from today. So this is our insights and inequalities report within DICE. As you can see on the left-hand side here, these are all of our live reports within DICE. Most of these now have, quite a few of them have the informal carer flag, which is fantastic. So actually, when people are using these for any reasons, for asthma, for long-term conditions, or any of the health inequalities, hopefully people now will actually start using the informal carers as a source to be able to try and identify. But I'm going to focus on the insights and inequalities today, because this gives you a very high-level overview of the patients. So this is our total population count for Dorset, and on the right hand side here, this is where we highlight and pick out informal carers. So you can see on here 100% of the population, 827,000, and down here we've got long-term conditions. As you can see, 24% of Dorset population have 3 or more. When you filter for informal carers, that becomes about 50% who have 3 or more. And this is what Lizzie was saying. These are the patients actually we could really be doing some work with, because actually these patients who are clearly potentially quite unwell themselves, and what more could we be doing to support those. But there's a wealth of information on here, the split between male and female carers, what percentage between the age brackets. We've got things in here around deprivation, ethnicity, BMI, whether they smoke, just to give you an example. But if we go to the actual long-term condition page on here, we can actually start breaking down and looking at what sort of long-term conditions are those. Well, most of those, so 18,000 have 1 or more long-term condition, but 33% of those patients have depression, 33% hypertension. Then we start looking also at the common combinations of long-term conditions together. Again, which is another really interesting insight. Some other things that have come from this, which have been used in some of the PCNs, are trying to increase the uptake of flu vaccinations for patients. If they've had their BMI checks, blood pressure checks, etc., because actually those should be being done as part of the the general health checks. So I guess it's, why aren't those patients coming in? Are there reasons behind it? We've also been looking at housebound, so housebound patients. So there are 500 housebound patients who are carers, and how are we reaching those? How are we supporting those? And so those are really impactful and really important things to be looking at. I could go on and on for this report, but I completely appreciate that there's other people who want to talk, and John, but also Faye.
Carmen,
so I will stop sharing. I'll let you talk.
Neil saying this is very good data. Do you send any digital test requests, e.g. via, what's that, AccuRx, with this data?
AccuRx. Yes. So so any data that feeds into system 1 could be via AccuRx, that should feed into here. So, but it all depends on how it's been set up, if it's actually sitting in the patient's journal and the patient's notes or not. But there's been so much interest from this from practices and from primary care networks themselves, and we expect the same with the integrated neighbourhood teams, who I think actually potentially could take over this. We've had a PCN who I'll end on a high, who has come to us about kind of some of the work that they're doing, because they're proactive trying to look at these patients, and they've been setting up health and wellbeing clinics, lots of different cohorts, but one of those being unpaid carers. And actually is really interesting. So many numbers have now been invited to social prescribing, which I know that you've been involved in, John. So it's really interesting, and because of all of the hard work that Lizzie and all of the team's been doing, it's forced them. They're looking at DICE, which is fantastic, but they're actually doing something with them, which is the most important thing, is that they're not just finding them, actually Carmen. Doing something.
I'm going to let you go to your other appointment and ask John to give us a couple of sentences about help and kindness, because that fits in with this data platform. How, John?
Thank you.
Yeah, thank you. I don't know if you got that slide there with the better stories at the top. I think what Carmen has illustrated and Lizzie as well, so brilliantly, is the fact that these stories raise questions. This data raises questions about how we work, what we can do with people, how we can pull together. I sit on the integrated neighbourhood team board for Dorset, representing the voluntary sector, and also various other things. Annabelle's in the call today, who is one of the brilliant people working with carers across Dorset. And as part of our work recently, we've been identifying where carers support is perhaps firstly not self-identifying, as was mentioned, so actually trying to build a better understanding of informal carers and where they are, but also looking at what the resources are on the ground. And that's our specialism with Help and Kindness, is knowing what's going on in the communities and looking at this in a very granular way. So an example being Lyme Regis in the extreme southwest of Dorset. For context, its geography is extremely steep, and so getting around and about in that kind of space to attend meetings and to do things, if you have any kind of mobility issue for a start, is actually quite difficult. But we recognise that there is a big gap between the potential number of people who are identifying as carers and the ones that we don't probably are out there. So we're using the DICE to explore the number of people who have 3 or more long-term conditions, which for one of the GP surgeries is about 2,500 people. But we know that there are only 260 people who've identified themselves as unpaid carers. We reckon that should be a much closer set of data. We should be seeing a lot more of those people. And half of the people who are registered as informal carers have 3 or more long-term conditions themselves. So there's some really interesting stories, and this is what motivates us. If we can use the data, we can start to tell stories, check them out, understand from our communities what that data might be telling us, build better connections, so working together across our entire integrated care system and with our commercial colleagues who run services in the area, as well as our public sector and voluntary sector, and where we can start to look at better outcomes. And the reason I mentioned the topography of Lyme Regis is the fact that during lockdown and the immediate period after COVID, the thing that took off was U3A online, and people were able to access services in Lyme Regis digitally. I'm very happy to do that. And so we're asking questions about, is this a better way to kind of encourage people to connect up and to work together to support informal carers, rather than having carers cafes and so on, which requires you to walk up and down a very steep road to go and find the cafes.
I'm going to cut across you now to say that was a fantastic couple of sentences, and I'm going to say that keep on joining things up. It sounds like there's a lot of activity getting data and people to services in Dorset. I'm going to stop sharing now and come back to the main room and say I'm going to hand over to you, Faye, because we're running short of time, and I'll put the slides back up. If you could,
Robert, you can skip the slides completely. I'll just go straight into our dashboard.
Lovely, thank you.
So I need to share my screen here, so bear with me a second. So for those that didn't quite catch us, my name's Faye Benskin. I'm with Tom Siddle. We are from the Centre for Care, and we are presenting the unpaid care dashboard today. So I did have some slides that go into all the details about what the dashboard is all about and how we created it. However, I'm going to skip all of those and not bother. And has that shared? Can you see our dashboard?
Yes, we can see that.
Okay, fantastic, lovely. Okay, so you can access the unpaid care dashboard, which was launched 2 weeks ago in Carers Week, via the Centre for Care online website. So all you have to do is Google Centre for Care, and you can get onto our homepage that looks like this, and then you click on the unpaid care dashboard. Do shout up if this isn't following through, but I'm going to assume you can see what I can see. So there's a really good description about the unpaid care dashboard, the origins of it, how it was created, why it was created, and a briefing about it as well. You can also see some tutorials, which are some animations that might help you to navigate it further if this demo doesn't quite hit the spot. So here we are, we've got the unpaid care dashboard. Now the unpaid care dashboard, its origin was the Valuing Carers report in 2021, which was worked on with Carers UK and the Centre for Care. And as a result, the researchers started to think about how they could bring census data together in a much more accessible and useful way for things similar to commissioning or understanding the horizon of how unpaid carers look in more local authority areas. So you can access the dashboard, and there are a number of different areas here. So if you look under the Valuing Carers report, there's a menu of click points. So as a first starting point, I'm going to show you the quick stats. So as you can see here, we have a screen which allows you to see the population of unpaid carers, the value of unpaid care. So the Carers UK report Valuing Care, it estimated the value of care across England and Wales at 162 billion, which is equivalent to a second NHS. And if you want to understand these values further, you can see on this right-hand side, there's a data description box that gives a really good explanation about what this really means. And as you work through the dashboard, you can pick out specific areas that you might want to look at. So if I lived in Bolton, I would look at that as a local authority. This is how it is being divided into the data. So you can look at Bolton, and you can see that there are 25,977 carers in that area. You can see their employment shared by industry. You can see the carer demographics, if they're married, if they are female, the ethnic minority, if they are religious, their qualifications, and carers out of employment. And just to be as quick as possible, I'm going to show you one of the others which might be of interest. We've got the unpaid care click point here, which gives some really nice data. I've kept with Bolton. So we can see that in Bolton, 59% of the carers in that area are female. We can see that 7.6% are in poor health, and 29% of those have a degree. And as you can see, like I say, with these visualizations, you can see a lot more information here that brings it to life much more. And one thing that you're probably most likely to be interested in is the click point here, which is health. So you can see, again, just to remind you, it's census data. So it's people that have ticked the box on a census, and it also includes census 2011 and 2021. And you can see here that we've got some graphs that talk on disability by sex, by the health, by hours of care that those carers are providing, and poor health by age, sex, and hours of care. There is also one other point that you may like to look at, which is the compare button. So you can look at how this has changed over time. So you could look at Bolton. I'm just going to go for one that's first on the list due to the need for speed. But we could look at this in 2011, and we could also look at the same area and how it might have changed to 2021. So those figures alter. You can see that the amount of carers across the local authority of Adur is it has decreased. So it's decreased from 6,700 to 5,800, but you can pick out your data there as well. So it's really interesting to be able to use the compare tool, and there are other options within this dashboard, but I'm really mindful that I can't show you very much more right now, but I didn't know whether there might be any questions. So I might just come back into the main space and stop sharing for now, and open up if you did want to ask any questions before we go back in.
Thank you so much, Faye. I've got a question. Has anyone else got a question? Looking around the room.
Ask away, Robert.
I'm interested whether your tool helps look at demographic outliers. For example, if you wanted to look for older people who are living with frailty, who themselves are carers, could you just sort of find out whether there are any clusters of those sort of intersections, if you like?
Tom?
Sorry. Thank you for your question, Robert. So at the moment, we don't have that functionality in there, but we do have kind of a feedback request tool, which quite a lot of people have suggested. This is something that would be really interesting. So in future iterations of the dashboard, then maybe that's something to look at because it seems to be of interest.
Thank you.
Yeah.
Lee, the question.
Yeah, just a quick one, really. On the dashboard, are you able to select multiple districts simultaneous?
Yes, we definitely are. So if I can just show you again, hopefully this will be able to populate. So there's a really easy way to do that. So if you go into the dashboard and you are looking at, let's go for unpaid care section. If you want to click so you may want to do an ICB, for example. So you could click multiple areas. So you click one and then you hold down the control button and you click the other multiple locations that you want to include, and that will naturally alter the data as you click through them. So that it adds it all together and allows you to be able to, like I said, bring together a local authority. One thing it doesn't do is a constituency, which some MPs have asked for, but it is local authorities.
Thank you very much indeed, Faye. Sian, I've seen your message saying we're being pulled back into the main room. So apologies again for the tightness of time, and thank you for joining us in this data and carers workshop speed survey. Looking forward to the connections that have been going on in the chat being pursued, but also it's super helpful to see live how you're able to use this. So thank you for taking over the screen and sharing the tools that you both are on using to unlock carer insights. Good luck on your endeavours, and hope you can join us, everyone, back in the main room now. On behalf of Iran again, just sorry we haven't had more time to do this justice this afternoon.
Thanks very much.
Thank you, everybody.
Thank you.
Bye now. Bye.
Robert, is there a way of capturing the chat that you could send to me? I don't know if there's been any requests.
I'll pass it all over to all the presenters.
That's really helpful. Thanks so much.
And thanks again for your adaptability.
No problem. See you later.
Marina, thanks for joining us. If you can find a way back into the main room, there's a plenary session now.
Thank you.
Emily, thanks for joining us. Okay.
Thanks again. See you soon.
See you. Take care.